Now, from the News Channel 5 Network, this is Medical Mondays.
Good evening, everyone. I'm Carrie Sharp. Thank you so much for joining us for Medical Monday. Tonight's topic, a great topic that I think a lot of people can relate to, and you probably have a question or two for our guest doctor tonight. Dr. Brian Tierney, he's a board-certified plastic surgeon here in town. He's here to answer any plastic surgery question you may have, but we have titled tonight's show, The Mommy Makeover, which is getting pretty popular among all plastic surgeons right now. It includes a lot of different procedures that you can choose from. Dr. Tierney, thank you for being with us.
Well, thank you.
The Mommy Makeover is kind of a marketing term, but I think a lot of moms can relate to it because after pregnancy, after childbirth, there are changes in every aspect of your body, it seems like. What are you hearing from women about things that they want to resculpt, kind of reconstruct after childbirth?
Right. You hear a lot. There's all sorts of different things that happen with childbirth, and the biggest thing is your abdomen. So excess skin, stretch marks, muscle issues with the laxity. Breast-wise, you have breastosis or sagginess of the breast or loss of the fullness of the superior pole. So there's lots of different things that go into it. And it's just a matter of kind of prioritizing what that patient wants.
Sure.
And then discussing the surgery and giving her all the details about that.
We're going to walk through this throughout the next hour of what people can have done, what they're asking to have done, what's wise to have done. So if you have a question, go ahead and give us a call. And again, we are kind of calling this the Mommy Makeover, but if you have a plastic surgery question tonight, Dr. Tierney is the guy to ask. Go ahead and give us a call. 615-737-PLUS is the number. That is 7587. We'll keep that number up there on the bottom of the screen. We'll get those calls lined up. If you have a question, you're wise to call in right now so we can get those calls lined up and get going, because I have a feeling this is going to be a popular show with lots of callers tonight. Knock on wood. I don't want to jinx us. But let's talk about plastic surgery in general. We were talking about this before the show started. It seems like much less of a taboo topic than it used to be, maybe 10 or even 20 years ago.
Sure. It's very popular nowadays. Everyone's talking about it. The websites, places to go online. So there's all sorts of discussions about it, and people go on Facebook. I know some people that will come into my office will have some injectables, some Botox or whatever it is, and then go online and take a picture. Show a picture and put it out there, and it's not like someone's going to judge them for having that done. So
you're not sneaking off to the doctor in the other city to have this done anymore.
They're not going behind people's back and trying to get into the doctor's office. So it's kind of nice. It's very open.
When you look for a plastic surgeon, when you decide, okay, I'm ready to do something different, I want to change my body, what should you be looking for in a doctor?
Well, someone that you get along with is obviously a big part. Someone that's board certified, that can do the procedures in a hospital setting if necessary. So people that are board certified have hospital privileges, and that means that that hospital has looked at that individual and they are certified to do that in a hospital, so you could have that done very safely. Anesthesia is also very important, that if you're going to be going to sleep for a procedure, you want a place that's going to be safe to have it done. So that's very important. You can look at reviews online, which sometimes you could get a mixed bag with some of that, but there's all sorts of
You're telling me about a website that's really popular these days for patients.
Right.
What's it called?
realself.com.
And what does it show? What does it do?
So it's got all sorts of procedures, anything you want to look up plastic surgery-wise, you could put it in there. They'll give you thousands of reviews of that procedure. Look at, all local, like a Nashville, if you want to see some Nashville doctors that perform those procedures and stuff. So it gives you all sorts of information about the procedure, from cost to recovery, and everything. So it's a really nice information gathering tool for sure.
And is this coming from patients about their experiences, or is it more of like, here's what you can expect medically?
It's kind of an interactive thing. So the patient's point of view, they have all the different procedures and their reviews, but also they ask questions, and some surgeons will answer those questions, so you get answers from all over the country about their procedure, or are they a good candidate. They could show pictures. Sometimes if someone has some kind of issue, they say, hey, is this normal swelling? I'm 1 week post-op. What do you think about this? And other doctors will give their opinions on that.
Okay, let's start from the very beginning here. When moms are usually coming into you, Are they nervous? Are they shy about what they want done? Or are they just like, I am here, I'm ready to do this?
You get all sorts.
Yeah?
Yeah, sometimes they're very ready to go. They don't have a whole lot of time, so they finally made the appointment. They're in your office, and they just want, this is what I want gone, this is what I want lifted, and they're just ready to go. Other patients will be a little bit more cautious. They want to look into it, you know, get the pricing, you know, what's involved, downtime, recovery, how they're going to kind of schedule help with the kids while they're recovering, and so it just depends on the home situation and how much help they have when they're going to do it.
Sure. So it's a lot of education up front,
right?
As it should be.
Sure. Yeah, you have to know as much as possible about these procedures and recovery, for sure.
What's your #1 procedure that you perform?
I'd say abdominoplasty.
Really?
Yeah.
And what can you do with abdominoplasty? We're talking about a tummy tuck. Is that more, I guess, the term that people use? You know, the real people use it. I want a tummy tuck. What would that entail? So
it would entail about 2-hour operation, and you usually have a low transverse incision, and as part of that surgery procedure, you'll have the muscle tightened, which will bring in the waist. You have the excess skin removed, and you also usually do some liposuction to contour the sides.
So what kind of scar is that going to leave you with?
So it's a low transverse scar, so it's going to be below like a bikini.
Okay.
And it may come up a little bit on the sides, but it should be very low. And it just depends on the shape, on where that scar is going to be exactly, but it's going to be very low and hidden.
Okay. And is it something that, is there anything that you can do arthroscopically these days, I guess, with tummy tucks, or is it?
Yeah, no, it's because you're removing skin, and when you're removing the skin, you have to
cut it.
Yeah, you have to make that cut. So sometimes you can do a mini tummy tuck, which is a little bit less of a scar, and it's more like a C-section scar, and bringing out or taking out some tissue in that area. But it all depends on how much extra tissue you have, what operation is going to be best.
Tell me about diastasis recti.
Right.
What is that?
So that is when the muscles, the rectus muscles are here in the midline. And when you're pregnant, they basically come to the outside more, and you need to bring those back to the midline. So you could do as many sit-ups as you want, but they're not coming back to the midline unless you actually bring them back with surgery.
Is that the same thing as a tummy tuck, or are we talking about a different operation?
So it's the same, it's part of the same operation.
Okay.
So when you kind of look at, you're removing excess skin, fat, but you're also plicating or bringing those muscles together so they go from outside to inside.
What can people realistically expect after having a tummy tuck? What should they expect to look at? Are they looking at six-pack abs or not?
Not necessarily six-pack. It depends on how much laxity of the skin above the belly button they have. So if you have very thin tissue and you don't have much fatty tissue, yes, you'll have really flat abdomen, six-pack type abdomen. If you're thicker above the belly button, that tissue is going to be pulled down, so that thickness is going to be about the same. You could do things like liposuction to improve that, but it just depends on the anatomy.
Okay. What kind of downtime are we talking about with a tummy tuck?
So I would say 2 weeks in general. 1 to 2 weeks. The procedure has gotten a lot better with pain control. There's some medicine now that you could actually put in to the tissues at the conclusion of the procedure and make it numb for 3 days. It's called Exparil.
Wow.
So it's a great thing, so you can go home without having any pain, which is a huge improvement for that operation.
I imagine, because when you think about anything, any kind of movement, you're talking about your core. So whether you're sitting up in bed or going to turn, that's going to involve your stomach.
Right.
How long is that sore?
So, yeah, it's about 2 weeks that you're going to be pretty sore with that. But with this medication, you're not sore for the first 3 days, so it's not too bad. It's a lot easier recovery nowadays.
Oh, good to know. Okay, well, I want to walk through each procedure step by step over the next hour. Of course, we are taking your phone calls too. Dr. Tierney is a board-certified plastic surgeon. Go ahead, give us a call, and we'll get you right after this break. 615-737-PLUS is the number to call. Stay with us.
Good news. I've got your settlement check right here.
What? That's great news.
What's next for you guys?
I think we're gonna go back to school.
That's a great idea.
Get relevant, timely health information you can use. Local experts and resources to improve the health of you and your family. Please join me, Amy Marsalis, for Community Health Matters right here on News Channel 5 Plus at 9:30 in the morning on the second Monday of every month. Because here in Middle Tennessee, our community health matters.
Watch Community Health Matters every second Monday at 9:30 a.m. on News Channel 5 Plus. Community Health Matters is sponsored by United Health Foundation.
She stands in the face of evil and will not lose hope or faith. America, the land of freedom, is still the home of the brave. So raise the banner, call no glory. Let us join our fellow man. History will write the story. America will always stand. History will write the story. America will always stand.
Take a look. Doesn't this make your mouth water? Tuesday on Talk of the Town, this will be your new favorite dessert.
The chefs from Puckett is sharing the recipe for their deep-fried brownie sundae, topped with candied bacon and spiced pecans.
Sounds great. Then what's on the bestseller list that you should put on your reading list?
Bookmen and bookwomen don't always agree on their favorites, but it's always a lively conversation.
Plus, there's still time for one more summer getaway.
Why the Smoky Mountains should be your next road trip Tuesday at 11.
Benjamin, thanks for being here. We're out here on Gallatin Road. The accident report shows you were not at fault. We've got your medical records, we've got the reports. We're going to try to get you as much money as we can, and we feel like we'll do a really good job for you.
Welcome back to Medical Monday, an exciting show for you tonight. We're talking with a board-certified plastic surgeon, Dr. Brian Tierney. Thank you for being with us.
Of course.
I know lots of you at home probably have questions that you would love to ask a plastic surgeon, but you don't want to go into the office. So now is your chance to call and ask that question. 615-737-PLUS is the number to call. We'll put that information on the screen in just a second. We have a few phone lines open, so if you want to call, now is a good time to do it. We talked about the tummy tuck last segment. Let's talk about breast augmentation. There are different ways of doing this, some lifting, bigger, smaller. When you talk about reduction, tell me a little bit about it. What should patients know?
So all sorts of different things to look into when you're looking at breast surgery. So you have, you know, either want to go bigger with the implants, or if you wanted a breast reduction or a breast lift. So they're all, you know, 3 different types of procedures there. Now there's sometimes where you can combine if someone wants to be fuller and lifted, like in the Mommy Makeover type of thing scenario, where you might have lost some fullness after breastfeeding and you want an implant for that fullness, but you also have some laxity of skin, so you want to bring the breast up. So you get what's called a augmentation mastopexy. So it's the implant plus breast lift, So some people just need an implant by itself, and they just want the fullness, and sometimes that implant can lift the breast in a way too. So the implant can go either under the muscle or on top of the muscle. So there's different ways you could put the implant depending on the patient's anatomy. You could bring up that breast a little bit if you put it sometimes on top of the muscle. Nowadays with the implants, like the silicone gel implants that are really good, you don't see the wrinkling, so you can put it sometimes on top of the muscle and bring the breast up with a lift with that implant.
Let's talk about that, on top of the muscle versus behind the muscle. Why do you do either one?
So this, again, it's based on that individual, what's going to be best. Sometimes putting it underneath the muscle, you're going to get a little bit more superior fullness. As far as mammograms go, if it's underneath the muscle, you can get a little bit better mammogram because it could bring that breast tissue into the machine and see things a little bit better. Things like capsular contracture, which is a potential complication of it, is a little bit less when it's underneath the muscle. So there's some favorable things for putting it on the muscle, which is a little bit more common, but sometimes putting it on top of muscle, you could have a little bit more natural look. You could have the muscle that's not been operated on, so you don't lose anything as far as activity goes with that, or strength. And also when you're contracting that muscle, if you're super active, if that implant's under the muscle, when you contract, it can give the breast a funny appearance. So sometimes if you're very active with that, putting it on top of the muscle can make it look a whole lot better.
What are we talking about downtime?
It could be just a couple days.
Really?
Yeah,
that quick?
Yeah, most people, I would say, get back to work if it's not anything super strenuous within a couple days.
What about downtime from the gym or working out?
So you need to spend a little bit more time away from that, because you don't want anything that's going to focus on the pec muscles or the chest. So you could do some light stuff at probably about a week, but you wouldn't want to do much as far as really getting back into things for, I'd say, 3 to 4 weeks.
Okay, so still not substantial. We're not talking months out of the gym if that's what's important to you.
Not at all. No.
I think that we've all seen people who have had, boob jobs or breast augmentations, and you go, that's what they had.
Right.
Because it just doesn't look natural.
Sure.
How do you prevent that? You were talking about over and under the muscle, but as a doctor,
sometimes people want
yes,
that
I'm
look.
Sure.
So some people come in and they want a fake look, and you can use different profiles of the implants. So depending on what the patient is wanting, you can make that happen. So if you want a more subtle look, tissues increased in size, but not too crazy, not the stripper type of look or whatever, you could have that. So there's anatomic implants, there's different profiles that you can go a little bit lower or moderate profile implant compared to like a high profile implant.
Do you make a recommendation based on what your patient is saying? Either I want to look natural, or no, I want everyone to know,
Sure.
you know?
Oh yeah, definitely. So depending on, and they try on implants in the office and sizers and kind of decide what looks good. I've had even a patient one time bring in her wedding dress to try on with the implants. So you could do whatever to see what it looks like, what works for you.
What works for you.
And then there's some limitations, and that's where consultation with your plastic surgeon comes into play. That it's just not unlimited. You could just do whatever. There's base width, how that implant's going to fit the breast, and you don't want it underneath the arm, and different things like that. So between discussing that with the patient and them trying things on, you find out what's going to work for them.
Let's talk about the implants themselves. A while ago, they got pretty bad raps, leaks and dangers to your health. What's the story today?
So they're very safe. Most of the times we're using the silicone gel. They're 4 to 5 generations past the original ones. So they're like a gummy bear implant. So you could cut these in half. They're not going to leak. There's no liquid. They're very cohesive. So they're very safe. There's saline implants that are still available that you can use saline, but that's not very popular anymore.
Why?
It's the wrinkling of them and the feel, the more natural silicone feel, and the less wrinkling of the implant. It's two of the biggest reasons, but they're very safe nowadays.
What about scarring?
So it's pretty minimal. It's about a 4 centimeter, which is only about that wide of a scar, and usually you put it underneath the breast in that fold. So that's
so you're really not going to see it on a daily basis.
No, and once it heals up, you can barely tell most of the times. Yes.
Complication wise.
So implants aren't permanent, and that at some point you're going to need an implant down the road, whether it's 10, 20 years, you don't know, but some people have them 30 years. But whatever it is, at some point you're going to need that implant probably changed out. So that has to be known. Complications, the immediate complications right after surgery, things like infection, swelling, those sort of things. You have way you heal, scar. So mostly those are the kind of the initial things. Then long-term things like capsular contracture, which we mentioned before, where you have scarring around the implant. That can be something that could come up in a year or 5 years. Pretty low rates of that, but that can happen. Rupture of the implants and other potential complications. So,
you mentioned the maintenance of them, the fact that you will need to have them taken out and replaced if you want them replaced, but how do you know it's time for that?
That's a good question, because sometimes you really don't know. You could have a silent type rupture where you don't really know if that implant's intact or if there's rupture. The thing is, the gel is a gummy bear. It's not going to leak, so it's not going to hurt you in any way. But usually if you have some sort of issue with it, you're going to have a little bit of pain, discomfort, some maybe localized swelling, some inflammation.
Your body will tell you.
Something's going to not feel right about it, and you'll probably come in, and then you could get an MRI. You could see the implant really well and do what you need to do as far as changing that out, which is a pretty minor operation to take one implant out and put another one in, but it's still an operation, so you try to avoid that.
Let's talk about breast reduction. What happens there?
So that's just a great operation overall. So that's an operation that insurance companies will pay for if you're large enough.
Really?
Which is a really good thing. It's a life-changing operation most of the time. So you can relieve the neck and back pain, the shoulder grooving, and all the different rashes and different things that comes with larger breasts. It's a little bit bigger operation than an implant operation. It's about a 2.5-hour operation and probably about a 1 to 2 week recovery time. But again, it's an outpatient. The scarring is a little bit different. You have to have incisions around the areola, up and down, and in the fold. Sometimes you'll hear that called a anchor type incision.
Okay, that makes sense.
So, but it's a very good operation.
I'm sure, yeah, like you said, life-changing for a lot of folks.
It's probably about 100% satisfaction on that. It's amazing, yeah.
Is there a certain size, or does it all have to do with your own anatomy where you really see the payoff that you start at for women, or how big they are to start with?
So you have to meet certain criteria as far as getting approved for the surgery. So you have to look at your body weight, your height, body surface area, and then there's this scale that you can look at. And actually, when they come in for a consultation, I can give them a good idea if they're going to have it approved. Now, you have to usually wait about 6 weeks with the insurance company to get approval, but I could pretty much tell you the day of consultation whether they're going to approve it or not just by looking at the weights.
You've done enough of them.
Yes, yeah.
We have a caller on the line. Let's hop to Eugene. Good afternoon, or good evening, Eugene. Thanks for being part of the show.
Yes, thank you.
Go ahead with your question.
My question for the doctor is, how much is the charge for the tummy tuck procedure?
Okay.
Good question. Very common. Yeah, so it's depending on anatomy, you're looking at between $6,000, maybe $7,500 range for everything. So that would include usually the surgeon's fee, the OR fee, and anesthesia, because it is a general anesthesia. So it's in that $6,000 to $7,000 range.
Okay. And with this type of procedure, this is a cash thing, or I mean,
that
you
is,
finance it, that sort of thing. But we're not talking insurance.
No insurance for a tummy tuck. No.
Okay, Eugene, that answer your question?
Yes, you answered my question, and thank you.
Thank you very much. What do you offer your patients? Because not everybody's going to walk in with the ability to pay cash.
Right. So there's things like care credit that you can sign up for, and sometimes they'll have like a 12-month no interest type of thing. Credit cards, but whatever it is, it's got to be paid up beforehand. The anesthesia and the OR fees, again, they do those separately.
Sure.
So you do have to have
consider that,
everything up front usually on all that.
All right, very good. We're going to have to take another quick break. I know we have more calls on the line. If you want to get in on the action, ask Dr. Tierney your question about plastic surgery. Here's the number to call, 615-737-PLUS. We're coming right back.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
I'm Storm 5 meteorologist Henry Rothenberg. Radar is not an issue. It's another beautiful, beautiful afternoon and evening all across the area. As we take a look at the temperatures, numbers are running pretty much seasonal, but humidity is still not too bad for this last day of July. At Nashville International Airport, here are the current conditions. This is updated every hour. The forecast heading into the overnight with a mostly clear sky. We're going to fall down to 67 degrees. And again, it's going to be pleasant out there. But during the day on Tuesday, which is also August 1st, southerly winds move back in. So that's going to help the humidity gradually inch back up. Our high temperature, a seasonal 90 degrees. We'll put a 20% chance of showers and thunderstorms in the forecast by Wednesday afternoon. Upping that some by Thursday with an approaching cold front that moves through Friday. Behind the front, dry, cooler air for next weekend with highs in the mid-80s.
crash landing at sea.
We just had a plane crash in the Gulf of Mexico.
Next Inside Edition. It seemed like a miracle, but was it? They recorded everything on their iPad, treading water for hours.
We seem to be okay without injuries.
You won't believe what authorities say really happened. Then, hot car crisis.
It's 130 in there.
What you should do if your pet is trapped in a hot car. Next Inside Edition.
Tomorrow at 4:30 on News Channel 5.
What's so important about your Monday morning?
Your Tuesday night.
Your Wednesday afternoon.
Whether it's your everyday routine or a special occasion.
We understand you've got plans. Don't let the weather spoil them.
Storm 5 weather is as close as your phone, your tablet, or your TV.
We have you covered hour by hour.
Around the clock.
Plan ahead
with the Storm 5 weather team.
Welcome back to Medical Monday. I have Dr. Brian Tierney here with me, a board-certified plastic surgeon. You operate, well, your business is in Midtown. You operate all over because you are,
right.
You have your own office. We've been talking about all kinds of different procedures. We're calling this the Mommy Makeover Show, which a lot of women are asking for these days. They've had their children, and I guess I should ask, you know, for the breast augmentations or lifting and the tummy tucks, should you wait until you are done with having children?
Definitely.
Okay.
Definitely wait. So tummy tuck would be ruined.
Yeah.
With another pregnancy, and pretty much the breasts wouldn't be as bad, but still, you don't want to have to get a lift or something down the road after you've already had surgery and go through another recovery.
Right. So
expense.
Just wait until you're done with the kiddos.
Yep, that's correct.
Okay. And is there an age where you say you're too young to do this or you're too old to do this?
Well, for silicone implants, you actually have to be over 22, but over 18, pretty much for any procedures. Yeah.
Okay.
Sometimes someone who's 16 and needs a breast reduction, there's special occasions where, with the parents' consent, that might be an indication to do. So.
Okay. Good guidance there. Let's also talk about something I know a lot of women struggle with, and that's the way their neck looks.
Right.
And you have an interesting procedure that you're doing, finding some pretty good results.
Right. Really nice results. It's called Tight.
Okay.
And it's a radio frequency heat energy that you can deliver in the office. And it is done under local, where you can just numb up the neck and you can tighten the skin. The collagen improvement and remodeling and tightening is amazing, and can go over a period of a year. So your results are going to improve through a year. And you're going to tighten the skin. If you have some extra fat, you can also do a little liposuction in the office. So this is all done in the office. You go home a day or two over the weekend to not do too much, but just kind of stay in with a little dressing, and that's about it. It's a really nice procedure. Is it a one-time
thing, or do you have to do it over a couple of months?
It's just a one-time.
One time,
yes.
And then you see the results kind of stack up over about
It starts
a year.
probably about 2 months where you really start seeing the results, but they are pretty amazing. I actually have a couple pictures on my website, and it is amazing, the before and after at 2 months for an office procedure.
Yeah.
It's really impressive.
And before this came about, those kind of results would have to be done in a facelift?
Pretty much, yeah. So there's really not an easy way to get rid of the extra skin of the neck, because you just can't cut it out.
Where's it going to go?
Yeah, you got to cut it out. So the facelift is the only way of doing a surgical procedure, but with this Tight, it directs the radio frequency heat right to the dermal tissue, which is where the target is, where you want to be, and that's why it's only a one-time deal. It's not like a laser that goes from the surface down and trying to get the heat, where you have multiple treatments. This is a one-time, and that's it.
And what does it cost?
Neck is about $2,500 in that range. So you could also do your lower face.
Would it take care of a double chin?
It would take care of a double chin, yeah, definitely.
Interesting, very interesting. I have to ask this, since you brought up facelift. Do people get facelifts anymore?
Oh, yeah.
With all the fillers that are out there?
Not as much. It's not as popular. Most people are going away from surgeries like that, and things like this Tight, fillers, Botox. You could do things like eye surgery in the office, so you could excess skin of the upper eyelid. So you could do things around the face with pretty minor procedures that really make a big difference.
Yeah, and I think that's what a lot of people are looking for. They don't necessarily want to go under the knife in such a drastic way that a facelift requires.
Well, it comes with a lot of risks too. So these are very low risk procedures. and a lot less expensive.
Now, the same device that you use for the neck tightening, you can also use a little bit lower on the body.
That's right.
For also some good results. And this is a topic that kind of is like, oh, should we talk about that? But a lot of women especially deal with these issues. So I do want to talk about it. I want to put it out there on the table. We're talking about vaginal rejuvenation.
Right.
What is that?
So with different devices out there, and this ThermiTight device also has a Thermiva.
Okay.
So it's a device that can treat both internal and external, and it is done in the office. Again, it's a pretty painless operation, and it is a 3-treatment regimen that you do every month, 3 treatments, and the results are amazing. As far as we're talking about the Mommy Makeover, and
right.
you know, some of the laxity of tissue, so it could tighten tissue up internally, externally. Menopause type patients, again with the dryness, this can help with that, and also with bladder leakage, which is a huge problem
issue
with
for moms who have given birth and
right.
things
so
just don't work the same.
This can be a non-surgical correction of that, so it's pretty amazing.
And this is relatively new.
Relatively new. This machine, radio frequency, that Thermi has been out for a little while. I've had it for about 3 years, and then this Thermiva is even newer than that, probably about 2 years, a year or two.
What are your patients telling you about this?
So the feedback's been pretty amazing. So it has stopped the bladder leakage. Everything as far as the rejuvenation has been improved. Some of even the husbands are commenting, and the feedback has been positive there as well. So it's done everything it's advertised.
Because you want your life to go on after having children, and that is part of it, right?
That is correct.
And it's an important part of it.
Yes.
When you as a doctor are looking at new things that come on the market, as far as these devices, what do you double check and triple check just so you make sure that you're doing the right thing for your patients?
Well, number one is the demand, as far as is something needed. When I got the ThermiTight device, it was with the neck. A lot of people would come in and say they wanted a procedure on their neck, but they didn't want to have surgery. So I started looking into devices, and then I talked to colleagues around the country that might have that device, and talked to them directly, and not a salesperson, about does it work? How do you do it? How does it fit into your practice? And go out and get some real discussion with doctors that have used the device. When the Thermiva came along, it was the same thing. I asked some other colleagues, but this realself.com that we talked about too, you could get on there and you could see a patient's response to different devices, and you'll see, like Thermiva, last time I checked, it was somewhere like 96%.
Wow.
Satisfaction with it. So when you have something that's high and you have 4,000, 5,000 reviews, it's doing soming.
That speaks
supposed
volumes.
to be doing. Yes.
Yeah, absolutely.
Right.
Let's dial this back a little bit and just talk about the Mommy Makeover in general, which a lot of plastic surgeons are saying, I offer the Mommy Makeover, but it's really up to the woman to say, these are the procedures that I am interested in, whether it's a breast augmentation and or the tummy tuck, or maybe a butt lift. Who knows? But how many procedures is too many?
You always want to make sure that the risks of each procedure and not doing too many in a row is all discussed. So that's why, if you have a kind of a list of priorities, what really bothers you, and if there's a couple different things, you may want to have different surgeries at different times with enough spacing between them to be able to do them safely. Because if you have anesthesia multiple times, week after week, it's not a good thing. So, so you definitely don't want to get kind of hooked on some of these procedures and get addicted to the surgery. But you don't really see that. I mean, if you're going to good plastic surgeons, they're going to kind of focus things on okay, let's do this set of procedures to correct this problem, this problem, then we'll look at something down the road.
Are there any of the procedures that you can do at one time?
So yeah, as far as the Mommy Makeover, the breast and tummy procedures are a great combination.
That's a pretty common thing?
Very common. So you can do whatever, breast lift, implant, and then a tummy tuck, do some liposuction. You like to keep the surgeries down. I like around 4 hours is a good kind of general rule. Sometimes you can go a little bit above that if the patient's very healthy and so on and so forth. But around 4 hours is a good rule as far as a one-time procedure. And then waiting plenty of time to recover from that, and just kind of getting back into normal life, and maybe looking at 3-4 months down the road of having something else done.
Walk me through what a patient should expect if they were doing the breast augmentation and a tummy tuck together. What are you feeling in the few days afterwards, and then what results should you expect and when?
So you'll start seeing results pretty much in a couple weeks. You know, you'll see right away some differences, but you're going to have a lot of swelling and bruising, a lot of pain. That medication I spoke of before with numbing the belly, so that right away you're not going to have a lot of pain with that. But you know, it's going to be a couple of weeks where you're recovering, and you're not going to see a whole lot of improvement until probably about 6 weeks. You really start looking at that. At 3 months, it's going to be probably about 90% of what you're going to see.
Okay, easy enough. We have another caller on the line. Liz is with us tonight. Hi, Liz.
Hi there.
Hi, go ahead with your question.
Well, I'm turning 50 this weekend.
Happy birthday.
I've never really been a big fan of my breasts. My breastfed 2 kids, and my husband told me I was too old to get breast implants, which I disagree. And so I was wondering what the doctor thought about a 50-year-old getting breast implants, and what the size would be for somebody. I'm on the shorter side. I'm 5'2", about 115 pounds, so I didn't want to get anything big, but I also wanted to look good in a bathing suit and not have to wear a water bra my whole life.
Okay, great question.
Sure, good question,
Is
Liz.
50 too old?
50 is not too old, no. So you definitely would be a good candidate for breast implants. You don't want to go too big, it sounds like, but you want to fill things back out. So, you know, somewhere probably around the 250, 325 range cc's would be a really good place. That's kind of where I would start. Like if you came to the office to try on some implants, that would be the range I would say to you start at and see how you like that. It's also good to bring maybe a t-shirt in or something so you can also see how it looks in clothes, which is a really good idea. But no, you're definitely not too old, and you know, a small implant, sounds like you would really enjoy that.
All right, Liz, thank you so much for your call.
Thank you so much.
Thanks, Liz.
Now, you say that's a small implant. Would you say the majority of the women that that you perform a breast augmentation on are going on the smaller side, or are you saying they're going big?
Most of them are going small.
Really?
Yeah, most of them are going pretty small. It's funny how most people that come in will say, well, I'm not like most of your patients, I want to go small. I hear that more than anything else, because most people really want to go natural. You know, they don't want everyone saying, oh, she had a breast augmentation. They just want to be natural, fill things out, and go, wow, she looks really good. So that's where, you know, 90% of the patients.
And would you say, as a surgeon, that, I mean, it is kind of an artwork, I would think, you know, finding the right size and the right shape for that person. Is that developed over time as a surgeon?
Sure.
That ability?
The ability to kind of figure out what that patient wants and to be able to deliver on that is a very difficult thing to kind of learn, because you could do a perfect operation, but if that patient isn't happy with it, if they wanted something else, if they wanted more fullness and they look more natural, they could be very unhappy with it. So you have to make sure you listen and be able to deliver what you're saying that you can deliver on.
So in your office, walk me through what happens before the surgery, whatever surgery that is.
So before surgery, you'll come in consultation, you'll meet the nurse with me, and we'll discuss, as far as the breast augmentation, we discuss the size, location of the incision, what type of implants, and I'll show all the different implants, and just have an open discussion what they're looking for. Sometimes people will bring in pictures and say, I'm looking to be like this, and sometimes that can be helpful, but you have to be realistic. You know, not everyone's going to come in and be a model with that, or not everyone's going to have a look like a pushed up Victoria's Secret bra. So you have to have some realistic things. So that's where you can kind of discuss things and see if that patient's realistic about what to expect.
And then you prep them for surgery. What do you say that needs to be done before surgery? I mean, how do you prepare someone for that day?
Well, as far as, you know, they can't have any medications that make them bleed, no aspirin, ibuprofen, those sort of things. So you have to go through medication lists and things like that. Otherwise, it's just about, you know, that you're feeling good, you're not sick, you don't have a fever, you know, all those sort of things. And then if they're healthy and ready to go, anesthesia will also do a kind of a history and make sure you're going to have a safe anesthesia, and there's some things there and some lab work that you might need, but it might just be a couple little things on labs, and that's pretty much, if you're young and healthy, that's pretty much all you have to do.
And then the follow-up after surgery, what happens?
So follow-up usually weekly for the first couple of weeks. So if there's a drain, as there is an abdominoplasty, that would come out usually at the week. Breast surgery usually doesn't have drains, so you don't have to worry about that. But usually first week, come in, make sure everything is looking good, get some of the dressings off, and then follow up the week after that. And then just depends on the procedure and distance they're traveling and things like that.
Now we're talking about the Mommy Makeover. Is there advice that you give to mom, maybe even small kids, of, hey, listen, you've got to worry about this after surgery?
Well, lifting, lifting restrictions. If you have a really young one, with a tummy tuck, you're not going to want to be picking up 15 pounds or something like that for at least 2-3 weeks.
Yeah.
So that could be an issue, or just running around. If you've had a breast augmentation and running after 2 or 3 year old, that could be an issue as well. So you have to be careful for at least a week or two after these surgeries to make sure things heal.
Yeah. Okay, you have to give yourself time. We're going to come back. We have one more big segment. So if you have a question, if you're sitting at home saying, should I call in and ask this question? Yes, you should. You should do it during our commercial break, and we'll get it answered right after. The number is 615-737-PLUS. We'll be right back.
It stands to reason the insurer that has to pay for your collision repair is going to want to save money on it. So don't be pushed into using their preferred body shop that may cut corners on parts and labor to keep the insurer's business. Come to the company that represents you to all insurers. The one company that's certified by your car's manufacturer. The one you can trust to make your car safe and new again.
Prices, collision, a perfect repair with a lifetime guarantee.
John.
Hey, Mr. Bart.
You called a little while ago and said you had an eating.
Yes, sir.
So I wanted to thank you and bring you a little food. We really appreciate you being our client. I'm glad you hired us, and you're going to be happy.
Wake the sun, tell him that I've begun to dream of things to come, and tell the trees not to look for me. I'm going to find some peace of mind. Wake the sun, wake the sun. Wake the sun, wake the sun.
My car's here. I'll be home tonight.
God, I wish he was still here.
Grief is normal after a loved one dies, but almost 1 in 10 people will get complicated grief. A grief that causes people to withdraw from life. It often strikes those who have lost a spouse they were unusually dependent upon, or lost someone to an unexpected death. Now, these effects can also include substance abuse, isolation, physical illnesses. Fortunately, we have effective treatments.
If you know someone who may have complicated grief, it's best to get treatment from a clinical psychologist or social worker. Treatment is covered by Medicare, Medicaid, and most insurances.
What's with truckers who speed when it's raining?
Please don't stop. If you drive around Nashville, chances are you have a road rant.
It drives me insane.
We want to hear them.
Are you nuts?
Send them to newschannel5.com/roadrant.
Welcome back to Medical Monday. We're talking with plastic surgeon Dr. Brian Tierney today, getting all your plastic surgery questions answered without having to go into the doctor just yet. We have Rosalind on the line. Rosalind, thank you for being with us. What's your question?
My question is, well, I'll just say, I'm working on losing weight, and I'm considering having breast reduction and possibly a tummy tuck. And I was wondering, should I wait until I lose a certain amount of weight, or is it something that I should go ahead and do to kind of give me some incentive to continue to lose weight?
You know what? We were just talking about this in the commercial break. I think you bring up a great question. So
Very
what
good question.
is the answer? Should you lose the weight first or not?
Well, she's in a little bit of a dilemma here. So with breast reduction, you have to, for insurance to cover it. Now, it depends if you want insurance to try to cover it or if it's cosmetic. If you want insurance to try to cover it, you have to have more weight to be removed. So actually, losing a lot of weight might bring you out of that.
Right.
But in general, doing tummy tucks or doing any of these surgeries, it's really good to lose weight and go down to about your goal. And then the surgeries will look that much better and they'll last that much longer.
Okay, and when you say goal weight, what do you mean by that? Because I'll just let you explain.
Yeah, so if someone's trying to lose 40 pounds and they're doing well and they get maybe 30 pounds of weight loss and they really can't do that rest, that's pretty close.
Okay.
You could do that surgery and you'll still look really good. You don't have to be at the exact pound that you wanted to be, but it's close enough. But the more weight you lose, the more skin laxity. So for the tummy tuck, you'll be able to pull tighter, you'll be able to remove more skin, you'll be able to remove more fat. So it's really nice to be closer to where you're going to be, because you don't want to do the operation and then lose 20, 30 pounds afterwards and then have some laxity and then wish you had it done.
You're back to square one,
right? It'll still look better, but you still would not be as good as you would ultimately be. So,
so Rosalind's kind of stepping on both sides of the fence there, depending on what she really wants.
True. I would still try to lose weight, get down to where you want to get down to, and you can see a plastic surgeon and see if the breast reduction might be covered by insurance, because it may not anyways. Yeah, so I would see if that is even a consideration.
Okay, Rosalind, I hope that helps you out. Thank you for being part of the show tonight. When insurance covers it mostly, obviously you said it has to do with a weight and a size and a ratio, but what are you hearing from patients about what they're complaining about when they want that reduction?
So when they come in wanting a reduction, it's usually the neck and back pain and shoulder grooving. So they can't work out, they can't run, they can't do a lot of things. Clothes-wise, they don't fit into things that they want to wear.
Yeah.
So it affects everything every day.
Sure.
Just working throughout the day, it gets heavier and heavier, and it's tough to keep on doing their job. So it's just a life-changing operation to be able to bring them back down into proportion. And sometimes you can remove, 4 or 5 pounds.
Wow.
Which is a lot of weight, because if you put a 4-pound weight around your neck, you're
going to feel it.
Yeah.
Quick.
So it's not going to be more than about 20 minutes where you want to get that
Come on, take it off, for sure. Okay, on the tummy tuck, because you said that is your most popular procedure that you do, the most common one that you do. Should people expect to walk away? We talked about the beginning of the show, because I want to talk a little bit about it again in case people are just joining us. But should people expect to walk away with a really toned stomach, like bikini ready?
Eventually, yes. Yeah. If having liposuction and the surgery, within, I'd say, 6 weeks, you're going to be looking really good, be very excited about things, and it's going to be a totally transformation.
Wow. Wow. And I guess, can someone be too thin to do one, or is it, what do you
not really. So if you're thin, you might have a lot of extra skin. So pregnancy, you get a lot of extra skin. So I've had tummy tucks where the patients pretty much all skin, very little fat, still needed the muscle plication to bring in that waist, but very happy, and those are the patients that look good right away.
Yeah. Very interesting. Okay. Why doesn't insurance cover that, though? That's always been my beef. With the diastasis recti, your muscles have ripped apart, and insurance is like, no, that's cosmetic.
Yes.
Yeah. The question probably everybody asks.
That is true. They will not cover a tummy tuck.
Yeah.
There's something called a paniculectomy, which sometimes they will cover if someone's lost a lot of weight. We're talking 50, 100-pound weight loss, and you have what's called almost like an apron, and it goes down low, and it interferes with hygiene. Sometimes the insurance companies can cover that, but even that's pretty rare.
Really?
Yeah,
it really
pretty
is.
rare.
You see some of these weight loss shows, and you see the dramatic change, but the extra skin that's left over. And
right. Yeah, the insurance companies try not to pay. is the bottom line.
I guess so. I guess that is the bottom line. You were telling me about some of the other procedures that you do. They may not be the most dramatic or the most popular, but I'm sure the folks who want them see a big difference, like the eye issues.
Right. So eyelid surgery is a great surgery to do. That can be done in the office.
Wow.
I could do it in the office under 2 hours easily, where you can come in, have it done, and you can go home. You can even drive yourself home sometimes.
You're kidding.
It's
Wow.
If you're not taking, because we don't take any Valium or anything like that. It's just under straight local. So it's a pretty easy recovery. You're gonna have a little pain for maybe a day.
How do you do it? What happens?
So there's a crease that's in the upper eyelid, and you make an incision in that crease and then take the extra skin out. Sometimes there's a little fat that needs to come out as well, but a lot of times it's just a skin operation on the upper lids. And you can just take out the skin and then suture it back together. The sutures come out around 5 to 7 days, and that's it.
And I'm sure the person has a much more refreshed look, awake look.
Much more, yeah. And that's where you focus. When you look at people, you look at their eyes. So for having a surgery done, one surgery, that's going to be a very good result for a pretty minimal type of recovery from a surgery. And it's nice as far as it's not as expensive because it's done in the office. So
what is the expense of something
you're
like
looking in the $2,000 range.
And that's something that should last a long time, right? I would think.
Oh yeah. So once that skin is gone, it's gone, and it's not going to come back. Well, 7, 10 years, gravity, aging, and all can still affect things, but even so, it's gone, and you should be good for a long time.
You mentioned earlier that a lot of folks are not doing the facelift anymore. It's not that you don't do them, but people are just choosing other things because there are other things available. Like what?
So we mentioned a couple already. So the eyelid surgery for the eyes, you have the thermotite for the neck and the lower face, then you have injectables, so you have fillers, and there's all different sorts of things like the Juvederm, things called Sculptra, which is an FDA medication that you could put into the areas that builds collagen. It's more of a natural look. So there's all sorts of different things to kind of bring volume back to the face, because what we kind of found out from like 20 years ago, where it was very popular to remove a lot of fat from the eyes, but they found out that you need that fat as you age.
Sure.
And the same with the face. So it's not about sometimes pulling the skin as tight, it's that you've lost some of that fullness from from fat and volume, so you need to replace that volume.
And that's where you have your wrinkles.
Right, and that's what brings a wrinkle. So if you could increase that volume either by filler or some sort of sculpture or fat even. So sometimes that's where you could put patient's own fat into the area. You could improve the wrinkles and not have to have a facelift.
That's very interesting. Okay, we have to take one more quick break. We are coming back to wrap things up right after this. Stay with us.
This is a Storm 5 HD weather update. Sign up for Weather Call at newschannel5.com.
I'm Storm 5 meteorologist Henry Rothenberg. Radar is not an issue. It's another beautiful, beautiful afternoon and evening all across the area. As we take a look at the temperatures, numbers are running pretty much seasonal, but humidity is still not too bad for this last day of July. At Nashville International Airport, here are the current conditions. This is updated every hour. The forecast heading into the overnight with a mostly clear sky. We're going to fall down to 67 degrees. And again, it's going to be pleasant out there. But during the day on Tuesday, which is also August 1st, southerly winds move back in, so that's going to help the humidity gradually inch back up. Our high temperature, a seasonal 90 degrees. We'll put a 20% chance of showers and thunderstorms in the forecast by Wednesday afternoon. Helping that some by Thursday with an approaching cold front that moves through Friday. Behind the front, dry, cooler air for next weekend with highs in the mid-80s.
A good story can inspire, motivate, even spark change. News Channel 5 is proud to celebrate what's right in our state. Join us as we celebrate Tennessee.
News Channel 5 and American Home Design are proud to celebrate Tennessee.
Do you need some wine? I do. Oh, my God.
Next, Ellen, the funny, the wild.
This is beginning to kick in. You didn't even have any yet. What do you mean it's kicking in?
Diane Keaton, she's showing off her new home.
That's a brick wall. Yes. Wait a minute, what?
Plus, David Blaine does the impossible.
Did you feel the cards go in?
Well, I didn't feel cards go in, but it was breezy.
Tomorrow at 3 on News Channel 5. With CBS All Access, you can watch News Channel 5 live from anywhere and watch CBS shows on demand across desktop, mobile, and streaming devices. Go to cbs.com/allaccess now to try it free.
Thank you so much for joining us here on this Medical Monday. And for those that called in, we appreciate your calls. Dr. Brian Tierney, thank you for being here and answering so many of my questions. I really appreciate it.
Well, thanks for having me.
How can folks find you?
So I'm at 2011 Church Street, which has been readdressed as 2004 Hayes Street, which is the back street of that building. But it's the plaza, and it's at Midtown.
Everybody knows that.
Everyone knows
Church
that.
Street. Yes.
And Tierney MD is my
You have your own private practice, so Tierney MD.
TierneyMD.com.
I was on your website earlier today. Very nice website. Folks can navigate it easily so they can find you. We're also going to show you how you can make an easy phone call or send an email to find out more. You can send an email to medicalmondays@ouradvancedhealth.com. Information on the screen, or call 615-986-6033, and they will direct you to Dr. Tierney. Just say you watched the plastic surgery show and figure out how to make an appointment. And some quick words of advice for folks looking for a good plastic surgeon. Obviously, you're going to recommend yourself, but you know there are fancy websites out there and they could direct you the wrong way. What should you look for?
I would definitely look for a board-certified plastic surgeon that can do procedures in a hospital setting, and then look at some pictures, talk to people. Actually, one of the best places to go are nurses in the OR.
If you know any of those, they know.
So if you know people that work in the operating room, they usually know who to go to.
They'll give you the real story.
That's right. Yes.
Dr. Tierney, thank you for your openness and honesty and your wisdom today. We appreciate that.
Well, thank you.
All right.
Appreciate it.
Thank you for being with us for Medical Monday. Have a great week, everybody. Good night.